All right, let's briefly talk about estrogen replacement therapy. There are still multiple ways of performing estrogen replacement therapy in women and even in men in some cases. The standard in the past was synthetic estrogen replacement or Premarin. As I mentioned in an earlier video, Premarin is actually a synthetic form of estrogen that was put together in a laboratory, extracted from the urine of horses, which is why it has the name Premarin, but we'll break that down later. What has now come about in terms of the evolution of estrogen replacement therapies, we've gotten away from laboratory produced estrogen replacement therapy to more bioidentical hormonal replacement therapy. The true estradiol that is naturally produced and secreted from a woman's ovary, and in some cases, even from the fat cells in our body, can be extracted in a number of different ways. And even they found a way of extracting it from plants, or what they call plant-based hormone replacement therapy. Many people know it to be BioT in the form of pellets that are inserted under the skin and can produce excellent results. It's also available in the form of bioidentical creams. You can use vaginal suppositories. There are still oral pills with estradiol. That is not the estrogen replacement, but actually estradiol, which is non-synthetic but bioidentical estrogen therapy. It's much safer. What they found is some of the increased risk for cancers associated with what we thought was appropriate estrogen replacement therapy is really as a result of inability of your body to break down some of the chemically produced bonds that were in the Premarin. They used a lot of nitrogen bonds and triple bonds that your liver and your kidney didn't have a way of breaking down. So you developed all of these metabolites that then increased your risk of excessive tissue replication, which promoted cancer-forming cells. Using more bioidentical hormone replacement therapy, you eliminate a lot of that risk. There's still some risks associated with hormone replacement therapy, but again, with proper monitoring and management, making sure that you're not over-replacing, making sure you have the proper balance of estrogen and progesterone as well as testosterone, it can be done quite safely and even more so effectively. What happens if we don't replace women's hormones? Let's talk about that in the next video.